Good afternoon. Welcome to our presentation today. Today I'm very much excited in that I have been invited by one of my colleagues, a dear friend of mine, to speak to you about the condition that affects men known as erectile dysfunction. I hope this information I'm going to share with you is going to be very useful and helpful to you people who are suffering from erectile dysfunction. What is erectile dysfunction? Erectile dysfunction can be defined or described as a condition that is characterized by failure to achieve and maintain an erection for satisfactory sexual intercourse. And it has been shown that this condition usually affects men who are 40 to 70 years of age, and about 50% to 30 to 50% of men who are in this age range suffer from this condition. And literature shows us that about 150 million people worldwide suffer from this condition, and it's been projected to go up to about 150 million people by the year 2025. So as you can see, this condition is very, very important, and it needs to be talked about so that people are empowered and aware of this condition, so that if they have to seek medical attention, they can do that with an empowered mind. So what are some of the risk factors for erectile dysfunction? So these are some of the risk factors among others. Age, as someone grows older, they are predisposed to getting erectile dysfunction. People who smoke, people who drink a lot of alcohol, people who have diabetes, people who have cardiovascular condition, and people who have hypertension. These, among others, are predisposed to having erectile dysfunction. And furthermore, some mental health issues, people who have disturbances in their hormones, such as testosterone or thyroid hormones, are also noted to suffer from erectile dysfunction. And people who have injuries to the spinal cord are also known to suffer from erectile dysfunction. So how then can we help these people who are suffering from erectile dysfunction? So in terms of helping, when you have this condition, or if you think you have erectile dysfunction, it is advisable that you seek medical attention. You see your doctor. Your doctor is going to do a very good history. They're going to examine you and ascertain the cause of erectile dysfunction. And then as such, they're going to design a treatment depending on what they find wrong with you. If your erectile dysfunction is due to psychological issues, then they're going to prescribe a certain algorithm of treatment pertaining to that. Then they may even advise you to see a sex therapist who's going to talk you out through this condition and show you some techniques that you can use to overcome this condition. If, say, they find that you have diabetes, which is affecting your erectile dysfunction, then they're going to prescribe treatment that's going to help you with your erectile dysfunction. So it's very, very important that you seek medical attention, and someone's going to help you, because we understand this condition is very, very big. Though people may not be talking about it, but if you've seen from the numbers that I gave you earlier on, it's a condition that will keep on coming, and it will keep on getting bigger as the population grows big. So in terms of management, like I've mentioned, we manage it according to how you present and the causative agent that we find within you. Of course, there's a medical treatment and non-medical treatment. So in terms of medical treatment, there are some oral drugs that we do give to our patients, and these drugs work on the blood vessels to dilate them so that blood flows within your body and to the penis, so that you can achieve your erection and maintain it to perform satisfactory sexual intercourse. Of course, I'm not going to mention the drugs, because some people may use them on their own, and they may end up having the side effects, and they may even die from them, because it has been noted that people have died from using these drugs for erectile dysfunction. And for those of you who are aware about these drugs and are using them, I'm just warning you to be very careful, and you should seek medical attention, because we understand that some of the symptoms or the side effects of these drugs are dizziness, hypotension, and some people just collapse. So you have to be very, very careful. And then apart from that, there are also modalities of injecting the drugs directly into the penis, and they work in a similar fashion as the drugs that you use orally. And for those who are suffering from hormonal disturbances, there are some hormonal replacement therapies that have been prescribed and that have been used successfully. So you can see your doctor. If they determine that your testosterone levels that are low, they can prescribe for you some drugs that are going to boost your testosterone. If it's your thyroid hormones that are deranged, they'll prescribe treatment for you that are going to stabilize the thyroid hormones. And the other modality of treatment is non-medical. So you can, for the non-medical treatment, we do use modalities such as encouraging people to be active by doing physical exercises, such as cardiovascular exercises. These include brisk walking, jogging, swimming, and bicycling. As you keep doing this, you rejuvenate your organs and you make your body produce certain chemicals that help with erection, achieving erection and maintaining it for satisfactory sexual intercourse. And apart from that, we also use some devices that we insert within your sexual organs to help you achieve your erection and maintain it for satisfactory sexual intercourse. So my advice to someone who's suffering from this condition is that don't despair. There is treatment for this condition. All you need to do is seek medical attention, and your doctor is going to take a good history. They're going to examine you. They're going to investigate you. And once they determine the cause of erectile dysfunction, they're going to treat you depending on what they find is wrong with you. Thank you very much for joining us. We hope to see you soon. Bye bye.